Good afternoon, should I say. I'd like to welcome everyone here to our monthly webinar, Making Catch Happen in Our Community. And I'm very excited to have two guests with us from the state of Illinois, who is in our prayers right now with the nasty weather you've been having up there. So thoughts stay with you. But my name is Peter Cribb, and I'm the National Director of the Catch Program at the Michael and Susan Dell Centre for Healthy Living at the University of Texas School of Public Health and the Austin Regional Campus. I did mention a little bit of housekeeping earlier, but I'll reiterate that just for those that may have joined us in the last few minutes. We're very excited about today's webinar, obviously, but some of the housekeeping we would like to take care of right now. First of all, our webinar today is being recorded and will be archived and available on Catch USA next week. That website is www.catchusa.org, along with a PDF of the presentation slides. During today's webinar, we encourage you to ask questions via the chat box, which you can access through the control panel at the top of your screen. You can type in your questions at any time, but to keep us on schedule, we'll hold off answering them until the Q&A period at the end of the presentation. When typing your questions into the chat box, be sure to select the option to send your message to all the attendees. Now, I'm delighted to introduce our distinguished guests today. I'm very fortunate to have worked with Margie and Rick just over 2 weeks ago now. Margie will be talking about the impact of Catch has had over the years in the state of Illinois and the incredible job that's being done up there right now. Margie has worked in public health for the past 20 years and is currently the Program Manager of the Physical Activity, Nutrition and Coordinated Chronic Disease Programs at the Illinois Department of Public Health. Margie's going to speak first and then Rick will follow. Rick comes to us with many decades of experience in schools as a PE and health coordinator and as a school administrator. He's currently the assistant principal at Springfield High School. So with that, Margie, welcome, and you may begin.
Great, thank you, Peter. Hello, everybody. We're delighted to be here. I hope you can hear me all right. We have with us also Kaylee Engel. She's been working with Catch for a couple of years at the Springfield Department of Public Health. So if you hear a second voice chime in, it'll belong to Kaylee. We have 10 years experience with the Catch program here at the Illinois Department of Public Health. We began with funding from the CDC's Preventive Health and Health Service Block Grant. And that was given to our physical activity and nutrition program with the charge to target children and their families. This was back in 2003, and it was sort of the beginning of the childhood obesity awakening. From 1998 to 2003, the prevalence of childhood obesity had been rising from 13% to 15%. And extreme obesity in children had risen from 1.75% to 2.2%. So the Illinois Department of Public Health wanted to address this. And a lot of homework was done. I would be remiss if I didn't give any credit to my predecessors, Joe Ambrose, Jamie Gates, and Jeff Sunderland, who spent close to a year researching children's programs. And there were a lot of programs that supported children's nutrition and physical activity. But after much research, Catch was the program of choice. It was proven to prevent and reduce childhood obesity and has been cited as the most cost-effective school-based program to do so. As public health practitioners, we spend public money, so we have to be especially careful and to be sure that a program that we promote and invest in is capable of delivering desired outcomes and is cost-effective as opposed to cost-prohibitive. So in 2003, the first schools were funded to implement Catch by our health department. So next slide. Oh, thank you. One thing that should be up there first and foremost is that Catch is cost-effective. Bottom line today, it seems that's very important. if we take all of the costs that it takes to raise a child in a given year and include their annual transportation expense, housing expense, public education expense, average household expenses, clothing, etc., miscellaneous expenses, and healthcare expenses, research has shown that it's close to $20,000 a year per child. The annual cost to implement Catch per child is $8.67. So certainly it is affordable. Catch is also very comprehensive. It involves food service, physical activity, personnel, classroom, family, community, and everybody really who's involved with the school. We've had Catch champions that have been janitors, and it is school-based. The family and the community involvement is a very strong component of Catch, and it needs to be carried over into the family and the community. One of the other reasons why we chose Catch as our program of choice, it is backed by solid data, it's evidence-based, and we now have 25 years of research that we can fall back on to prove that. One of the biggest things, though, is that Catch is very rich in resources. There are very good training programs for Catch. It's available, it's excellent, it's fun. The curriculum is available, the PE equipment is available, physical activities are available in an activity box, and all of these availability of resources is especially important when we're asking any school to implement any program for children, especially something like physical activity and nutrition. Teachers are fairly ill-equipped to teach a nutrition curriculum in all of their lesson plans, grade after grade, and certainly not well-equipped to do age-appropriate physical activity exercises during the day with the children. But the Catch program has all of that, and it's easy to understand. Catch is fairly easy to implement. It is sustainable without continuous funding. A booster training now and then is always good, and it is always important to continue with the Catch champion. If one leaves, another one would be replaced. And it's also fun. The Catch mantra is that if it's not fun, it won't get done. And the children love Catch. The teachers like Catch. The families catch on fairly quickly, so it is a very fun program. So back in 2003, the Illinois, next slide please, the Illinois Department of Public Health did a pilot study with 6 schools. These schools were chosen based on their interest, their ability to implement the program, the administrative support that they had to implement the program, the fact that they already had a Catch champion that had expressed interest, had called the health department to say, what can we do for children? And they were scattered across the state. Care was taken to make sure that there were some in the northern part of the state, the southern, the east, the west, rural, urban, and suburban. And then they met with the Catch champions at the school and began to talk about Catch implementation. A Catch champion is extremely important. I'm sure Rick will hit upon this a little bit later, but it's important for successful implementation. It's important for successful sustainability. And the Catch champion can be anybody. It can be a PE teacher, a food service staff, a classroom teacher, could be the administrator, could be the janitor, anyone who seizes the opportunities and can spread the word and the contagion for Catch throughout the school. We've had some very unique and innovative things done by Catch champions over the years. So the process was we provided each school with $5,000, and that $5,000 was to pay for their staff to be trained. It was also to purchase the curriculum, some PE equipment, and maybe $800 to $1,000 to sponsor a family fun night that they could invite the community to. 2 of our staff were trained as master Catch trainers and were able to go in and assist with the training of the school personnel. And those 2 staff members gave very close and continual technical assistance to the schools during their implementation of Catch, especially during the first year. Close follow-up was done. Quarterly reports were generated by the Department of Public Health. They were sort of sent out in a format to the food service person, to the administrator, to a classroom teacher, to the PE teacher, and asking various things. Has your catch committee met recently? How often? What have you done to implement catch? And especially, what were the barriers to implementing catch for you? And then those reports, those quarterly reports, were looked at and used to assist the school staff with easier implementation. The staff was also assisted with evaluation at that time. It was a lot to ask early on that they implement the program and evaluate it all at once, so our staff helped with the evaluation. They did the SOFIT evaluation system for observing fitness instruction time, both pre and post test. They did keep track of cost and time documentation, and this information was all filtered to Western Illinois University to determine cost and cost effectiveness and time and success of program implementation. It is important to notice that at the end of the year, no school opted out and they all continued on with catch the next year. So the following year, an additional 9 schools were chosen to implement catch. The initial 6 kept implementing catch. And then you can see how, from the chart on the board, how it progressed over the years. In 2005, we continued to work very closely with the 15 schools. In 2006, an additional 25 schools were added. And at this point in time, it got to be a little bit much for our 2 staff to do all the school trainings. And so a training academy was held where about 12 to 15 trainers were trained, and these certified catch trainers then were able to go into the schools near them and do the implementation training for school personnel prior to their implementation. The trainers at that time were chosen to represent the state geographically. So if any school statewide expressed an interest to implement catch, we would be able to find a trainer for that school within a reasonable length of travel, and that is usually within about an hour and a half. So then in 2007, we had an additional 39 schools. In 2008, we had 44 schools. Another thing that happened in 2008 is our Illinois Department of Human Services has been the state agency in Illinois that receives coordinated school health funding. They had received coordinated school health funding since the year 2000, had granted that to 29 grantees, and those 29 grantees were charged with implementing the coordinated school health model in their school districts. In the year 2008, after a couple of years of those schools struggling, not knowing quite how to get started, it became mandatory that if they were going to receive that funding from Department of Human Services, that they should be implementing catch. And that made things so much easier for them. So we funded 44 schools. The Department of Human Services was funding some schools also at the same time. And that went on. We added schools every year. And then in 2010, you'll notice that after we funded the 44 schools, 2009, 26, 2010, 24, this is when our funding began to be cut back. It was getting a little bit more difficult to keep on expanding, although that was being done through our partner at the Department of Human Services. So in 2010, our funding went district-wide. Previously, we were funding school by school by school. And in 2010, we decided to take a different approach, see how it worked, and we funded entire school districts. The largest school district that we funded in 2010 was the Springfield School District 186. And at that time, Rick Sanders, our next speaker, was the catch coordinator for all of the schools in that district. It turned out to be very successful. Illinois Department of Public Health staff, with the help of 2 other organizations in town, SIU School of Medicine and Generation Healthy, assisted with the evaluations. So we administered the SPAN, the nutrition questionnaire, in the fall, did SOFIT in the fall, and then came back in the spring and did the post-test and generated a report that the school district could use as to the success, and it did show success in both areas. In 2011, our funding was a little bit less again, and at that point in time, we were receiving a lot of requests from local health departments and other local organizations that were willing to assist schools to implement CATCH, and from schools themselves that wanted to implement CATCH. And of course, everybody was looking for funding. At that point in time, we decided that the fairest way to go about it would be to put out an RFA. So we generated an RFA and we put that out. And still we stuck with the same approximate $5,000 per school, which to this day works pretty well. And at that point in time, we were able to fund 14 schools. So by at the end of 2011, the Illinois Department of Public Health had funded 187 schools to implement CATCH, and that was impacting more than 60,000 children, their families, their teachers, and their community. And the Illinois Department of Human Service was implementing CATCH was assisting to implement CATCH in 119 schools. Then we came along to 2012, which I call the perfect storm for CATCH. By this time, childhood obesity had captured national attention. All schools had a school wellness policy, while they weren't necessarily implementing them in the areas of physical activity and nutrition real strongly. By the time 2012 rolled around, people were looking at their school health policies a little bit more, taking them off the shelf, adding physical activity and nutrition policies to them if they didn't initially have them. The Institute of Medicine also came out with a report titled Accelerating Progress in Obesity Prevention, Solving the Weight of the Nation. Many of you may remember that. It came out with 5 basic recommendations to accelerate progress in obesity prevention. And the last one is we must treat schools as the heart of health. But the other ones, and let's think about the CATCH program, the other ones are integrate physical activity every day in every way, market what matters for a healthy life, make healthy foods and beverages available everywhere, activate employers and healthcare professions, and again, strengthen schools as the heart of health. So we were getting national attention on the childhood obesity issue and national recommendations for the schools to start addressing this. There was an increased interest in CATCH, and at the very same time, the Illinois Department of Public Health was awarded a community transformation grant from the Centers for Disease Control, which we here in Illinois call We Choose Health. And so we began our efforts in our We Choose Health. Next slide. And so the We Choose Health grant, the Community Transformation Grant, had to address 3 categories: healthy eating and active living, smoke-free living, and healthy and safe built environment. Illinois selected 7 strategies to address these 3 categories, and the strategies we addressed are up on the slide, and you'll notice that it includes safe routes to schools and coordinated school health, and also worksite wellness, all of which are addressed by CATCH. We had 21 grantees that covered 60 Illinois counties and impacting over 3 million people. Of the 21 grantees that we awarded community transformation dollars to, 17 of those grantees chose to implement the coordinated school health program in their school districts. It was a requirement. They go district-wide. And when I say grantees, they range from one health department that represents a county of 31,000 people to regional health departments that combined we have down in southern Illinois, they're addressing 18 counties, which entails probably close to 100 schools. So CATCH is being implemented in most sites that chose to do the coordinated school health, and suddenly we had a demand for more trainers. You'll note that I mentioned before we had about 10 to 12 trainers scattered statewide, and these people were not full-time CATCH trainers. That's not all they did. Many of them are health department employees, And they did training on the side. They took time off to go train a school, or they trained a school in their district. And we were getting calls that people wanted their schools trained. So in this year, in 2013, rather than funding additional schools, because we're already funding 17 grantees that are targeting over 300 schools, we held a training academy the first week in April. We were lucky that Peter was able to come in for that. We were grateful that Rick Sanders loaned us the Springfield High School for its venue, which turned out to be perfect. And we did put out a scholarship application. The Illinois Department of Public Health paid for attendees to the training. We paid for their travel. We paid for their hotel. We paid for their food. And we bought them all what they needed to go forth and train schools, which included a training manual, a coordination school kit, and some physical education equipment, such as cones and scarves. So we provided all of that to those who attended. One thing that this did was we really encouraged the trainers to be from a local area. In order to get the scholarship, they had to demonstrate why they wanted to be a trainer, but they also had to demonstrate that they already had an existing good relationship with the school in their district, and that they were ready, willing, and able to implement catch. They just needed the training in order to train the schools. So this was a Train the Trainer program. It was a 3-day academy, and at the end of that, the attendees became certified to go forth into the schools and conduct the 6-hour implementation training for school personnel. And that was 2 weeks ago, and I mentioned we wanted them to be ready to go. I just got a call from one of them today, and she was on her way to her first training today. So within 2 weeks, people that had attended the academy are beginning to train. During that time, Peter also worked with 2 people who have had extensive experience with implementation training to the schools throughout Illinois since our first training academy back in 2006. And they co-facilitated with Peter and became master trainers. So we now in Illinois have 2 master trainers. We have 41 current certified catch trainers. And the trainers come from a wide variety, which, like us, it's not all local health departments. There are many local health departments, and probably the majority were, but they also come from community-based organizations. Let's say one of our communities is called DuPage, and it's a county here in Illinois. They have a community partnership called DuPage Forward, which has many partners from the community representing as part of DuPage Forward, and DuPage Forward sent a person. We had people being trained from the American Cancer Society, the YMCA. We had 2 different hospital systems, which I found interesting. These hospital systems have chosen the implementation of catch in their regional areas as their community benefit program. So they trained, some hospital personnel from their hospital systems. We had 2 people representing universities that assist with the training and also assist with the evaluation of catch implementation in their school districts, and PE teachers. We had a couple of PE teachers at the training. So moving forward, it is the dream of Illinois Department of Public Health to have at least 1 trainer in each county, which would be beneficial for the schools and also for the trainers not to have to travel too far. We're probably about 1/3 there. We're working towards implementing catch in every school, which I know Peter and everybody else who's involved with catch would love to see catch implemented in every school because it works, it's fun, and it's cost effective. And we are working with our community partners, especially the YMCA and the American Cancer Society, to implement Catch Kids and after-school and summer programs. It was a couple of years ago that we spoke to both the YMCA and the American Cancer Society when they were thinking of funding other schools to do catch. And American Cancer Society said, well, if Illinois Department of Public Health is only doing the elementary school implementation, our agency will fill the gap with the after-school and summer schools, and the Y is also assisting in that matter. So one of the other things that we have also a couple of dreams with Illinois. We will be tracking these schools that are implementing catch, and we will be overlaying them with our childhood obesity rates in this state. We need to do a better job with sharing our successes. I have our data. We shared it with the Springfield School District, for instance, when we assisted with their evaluations, and that's about it. But we would like to put that up on our website, overlay, and really start talking about the success of catch. That's how it will spread more. So one of the ways we're going to do that is starting with today, and I would like to introduce Rick Sanders, who probably took on a little bit more than he thought he was in for when he became the catch coordinator for the Springfield District 186 2 years ago. He did a fabulous job coordinating all of this. So Rick, your turn.
Okay, thanks Margie. Here's a slide with just some background information about me. So basically I've been with the public schools here in Springfield since 1984. I came in as a PE teacher, then taught math and health, and I was a coach and athletic director and assistant principal and then a principal and coordinator of athletics, PE, and health. And then this year I've maintained the role of coordinator of physical education and health for the district, and also the assistant principal here at Springfield High School. So in 2010, basically in 2009, 2010, I was the coordinator of athletics, and then beginning in 2010, the district indicated that they would also like for that person or my role to be coordinator of PE and health. And the person before me had applied for a grant, and we received $150,000 to implement catch at all of our elementary schools. And so I came in kind of in the middle of that grant and everything that was happening. Thankfully, Margie was around to help me get through that time. And but the money came in very handy. We were able to provide all of our PE teachers with the necessary supplies, equipment, training, consultation, family health fairs, student health fairs. We had gardens. GenH was a big help, which is a local community organization. Stands for Generation Healthy, which Margie had mentioned earlier. And they came in and did a lot of the health fairs for us and things of that nature, and initiated some of the gardens. And so things were moving quite well during 2010. We also had a booster training at the end of the 2011, the 10-11 school year. And the collaboration we felt was very, very important. Also, at the beginning of the 11-12 school year, we brought in another trainer to have additional training and really some planning time for all of our catch teams to prepare for the 11-12 school year. In order for a successful program to take place, for the catch program to be implemented fully, every school has to have a champion. Like Margie said earlier, that doesn't always have to be the PE teacher or the health teacher, but they must keep the mission of catch in the minds of all the stakeholders, which basically means we've got to keep the catch practices, the philosophies, the mission of what catch means in place as much as possible, meaning looking for ways to integrate activity, wellness, health into what we do on a daily basis. And that's got to maintain the forefront in order for this to be successful. My role was to go ahead and to continue to hold each school and each catch team accountable for what happened in their building, And a lot of times when somebody's looking over your shoulder, then you're going to go ahead and maintain that accountability. From what we saw, needed about 4 to 5 staff members that were passionate about wellness. In most cases, we really tried to get our PE teacher, and again, our elementary buildings are kindergarten through 5th grade. So it was great to have a cafeteria manager on board. Many times our nurses would share 1 or 2 or 3 elementary buildings, and they would be on board as well. It was helpful to meet at least one time per month. Most catch teams did, and they invited me, or they let me know on their calendar when their meetings were. I would try to attend those meetings as much as possible. And the benefit of that was, again, the additional collaboration and sharing ideas from one school to another school. That actually increased my awareness of what different strategies schools were using, and I could share that with various schools. 2 times a month would be ideal, but actually 1 time a month seemed to be sufficient as well. And obviously, it'd be great to have the principal on board. I saw where catch teams that did have the principal seemed to progress at a little bit quicker pace than other teams that didn't have the principal on board. And basically, if that wellness team or that catch team can establish a calendar of events for the year, again, that's going to keep things up front. That's going to maintain interest. We have something that we're working towards each month, whether it's a theme, an activity, an idea, and certainly something that we need to go ahead and keep moving towards, and having, in some cases, a culminating activity that encompasses wellness and catch ideals. Some of the things that our catch teams took a look at was just our current policies around nutrition and fitness activities. And again, these are things that can be done without any additional resources, if you will. Many times, programs depend on money for those programs to be successful. But here are just some things that I had noted that could be done really without any money. You know, recess before lunch is just a scheduling situation, and a lot of our schools began to schedule recess before lunch, so kids would have at least 15 to 20 minutes to eat. Many times kids would just want to rush outside for the playground and ignore food, but a lot of schools noticed that the kids ate more, and it was a quieter time when they did have that. With birthday parties, a lot of changes were made in a lot of our schools regarding birthday parties, and you know, anywhere from providing treats, if you will, on their own, to minimizing the number of celebrations per month, to mandating that only pencils, pens, paper, school supplies be handed out as treats, if you will. Recess too. I mean, unfortunately, with state scores kind of driving instruction throughout the course of the day, recess became a thing of the past, and so some schools began to implement more recess time, or even during the class time, as in these brain breaks. Some of our classes, especially language arts and math, were scheduled to take place in blocks of time, and for 2nd and 3rd graders to be maintaining a level of interest, we had to figure out some ways to break some things up. So brain breaks took 2 to 3 minutes to get the kids moving, and if the teachers were really organized, they would incorporate and integrate mathematical or literacy terms into that brain break. After school activities, many of our schools began having more intramurals, where there's boys basketball, girls basketball, cheerleading became a part of that. We had girls on the run. Mileage clubs at lunchtime. Kids would walk a certain distance and get a certain little trinket, and then they could trade in trinkets for greater medallions or bracelets or things of that nature. We had a chef come in. Various schools, Gen H provided a chef and would have cooking demonstrations for our staff. One school even had a jump start activity where the first 10 minutes of each morning, staff and students would watch a video and would exercise for the first 10 minutes. So it can be, you know, the list is endless as far as what schools can do, and it just has to be interest there, and somebody has to figure out a way to go ahead and make these activities happen before, during, or after school. For those folks who went through the training, and presuming that we still have the am doing, can do, and will do, this is just one example that one school submitted. And at the beginning of the year, or actually to begin with, at the end of the year, I collected this chart from each school, and then went ahead and sent that out to all the schools again, so that way they could see what the other elementary schools were doing, what their goals were, what they're currently doing, what they could do, and what they will do. And then at the beginning of the year, we would send those out again, because the catch teams would change, and we might have a different leader. But what we wanted to do was maintain some consistency with what the school was doing, and also for schools to take a look, and they hopefully were implementing subtle, small changes along the way that indicated this is how we do things around here. And if they could just reduce to paper what actually they're doing, so they can see their accomplishments, then we thought that that would help too, promote the activities and promote this philosophy and mission, and for the schools to realize that, hey, we are doing quite a bit here. We may not realize it, but look at all we're doing, and now we can take some things possibly just to the next level. It's very, very important. Schools that have the administrative support, now fortunately for us in central office, you know, the district had the support of the position I was in, and I was behind catch 100% in the wellness activities and having the background that I did. Unfortunately, not every principal has that sort of background, and so some were struggling and hesitant to include some of these things during the course of the day or during the year. But if they can't be involved directly, they must be supportive of the catch team and of the catch facilitator. That person has to have a great deal of flexibility and autonomy to go ahead and schedule events and programs, initiate or implement initiatives as far as some ideas that they might have. And again, and that's where the catch team comes together, and they can pull in various resources to help this happen. And that's where having a person, even part of the team, we have a person that's just responsible to work with the community members and businesses is great. They wouldn't necessarily have to report to the catch team, but if the catch team would report to that person and say, hey, this is what we're thinking about doing, do you have a contact for this, or do you have a contact for that? And if somebody asks for little, they get little. And trust me, there's enough people around this community now that they go running for the dishes when they see me, but we've got to ask folks for some help, and a lot of times people will help, but they've never been asked. And so we've got to reach out and do what we can do to help kids incorporate more wellness, more healthy activities. And so really, if the catch team could just simply adopt a mission statement, and really, when we keep this to the front at all times, keeping health, wellness, nutrition, fitness as a supplement to all of our activities. In other words, whatever activity we do might relate to wellness and healthy living. For instance, as a reward, a lot of our schools are PBIS, and maybe as a quarterly reward for students, instead of providing pizza or ice cream or something like that, they might give them an extra 30 minutes of recess. Or even in middle school, a lot of times they'll have an extended recess for kids. And so we want to make this something that's more beneficial and can increase physical fitness. Another goal, another mission is for our teachers, at least one time during the day, to incorporate catch in our daily curriculum, whether it's math, language arts, what have you. But as long as we keep that the terminologies in our classroom on a daily basis, then the focus of catch and wellness will always be there. Supervisors, cafeteria managers can label the foods that they serve. Supervisors can acknowledge and hopefully reinforce and encourage kids when they see them eating Go foods, and provide those students with reinforcers as they do that. And really educating all of our stakeholders. That's our parents, that's our community members, that's our teachers. That can be done through, communication anymore is very, very easy, especially in elementary. We have the Tuesday folder. We had a local hospital provide us with a saying of the day that was health related. So when the announcements were made, either at the beginning or the end of the day, that saying was just one sentence that was indicated and said during that time. Sometimes catch teams would have something every month, a newsletter that they put out every month that went in the Tuesday folders. They would again organize activities to bring in community members and families. And so these weren't really that challenging, and we would really incorporate little baby steps and just doing one thing at a time. And we know this is a long-term project, and education is always slow to change. And what we don't want to do is add anything extra to our teachers or to our staff members or administrators at the schools. So our goals are just to do one thing or two things, and as we get good at that and that becomes part of our culture, then we add something else that we can easily integrate into our daily life in the school building. So there's just a slide. If you have any questions or anything or want more information, feel free to email me or call me at any time at that number.
Great, thanks Rick very much, and Margie, thank you so much, and congratulations to both of you and Kaylee for the great work that you have been doing all over these years, in almost 10 years now, in Illinois. Due to our little technical difficulty in the beginning, we're not going to have time for questions, but if you folks would like to email me your questions, I'll touch base with Margie and Rick and get the answers for you. I'd like to just finish by saying another thank you. Again, Margie and Rick and all the 44 trainers and 4 master trainers in Illinois for all the work you're doing to create, support and reinforce a healthy environment in the schools and the after-school programs in Illinois. Thanks so much.